Are you curious about what it's like to use a gestational carrier? Maybe you're thinking about this for your own family building, or you have a loved one that is using surrogacy as a part of their journey. You have so many questions. How do you find a gestational carrier? What is their motivation for doing this? And can you nurse a baby if you didn't carry it? We're going to answer all of these questions and more. Welcome to the Brave and Curious podcast, the podcast where we do a deep dive each week into understanding fertility, reproductive health, and wellness with science and compassion. I'm your host, Dr. Lora Shahine, a double board certified OBGYN and reproductive endocrinologist. And this week, I am curious about surrogacy. Surrogacy is a beautiful way to build a family, but it can often be confusing and overwhelming as you're learning about the process. Today, we are welcoming back a guest that was well received, Mollie Hyuck. She is the director of the Gestational Carrier Program at my practice, Pacific NW Fertility in Seattle. We had her on the show previously talking about the steps of starting to learn about the surrogacy journey, how to find a gestational carrier, and really important steps. So if you want a step-by-step guide of the journey, go back and listen to episode 123. Today, we are asking Mollie some really specific questions that listeners asked me on Instagram, on YouTube, on TikTok, and just through this podcast. It's such an incredible topic, and there's so many misconceptions. I am so excited to ask Mollie more questions today. Mollie, thank you so much for coming back to the show to talk more about gestational surrogacy.
Thank you so much for having me back.
Yeah, well, we talked about so much the first time that you were here, really getting into the new patient visit and kind of people who are brand new to thinking about trying to find a gestational carrier, like the journey and expectations and timeline and cost. I think that is so important. But it left me with so many more questions. I wanted to kind of have you back to get into the nitty gritty of some things that my patients ask me all the time.
Absolutely.
Okay.
I'm happy to help.
I love it. So I reached out on Instagram and on TikTok and asked the questions, what are your common questions or myths about surrogacy that you want to see busted? And we covered this in the first time you were here, but the number one misconception is that surrogacy is for the wealthy or celebrities that just want to keep their figure. And I just want to emphasize again, is that what you're seeing when you are helping people through their surrogacy journey?
I would say that definitely is the number one myth that I love to bust on a daily basis. Yes, absolutely.
Yeah.
I think because we see it in media and we talked about this, we see it in video and media and movies. It isn't just for the elite, or it's not just for movie stars. It really can be for many of us, myself included, that need this as a viable pathway to become a parent.
Yeah, I know. And I feel like it is portrayed in movies or, on TV as sort of a last or a flippant choice. Like, oh, sure, I'm just going to, find a surrogate and, everything's going to work out just fine. And they don't talk about the emotional piece or, kind of the reasons that most people choose this path is it could be a cancer diagnosis. It could be a significant health issue. It could be that they have been trying to conceive and having multiple miscarriages. And it's not usually, in my experience, a first choice. Like people aren't coming to the clinic and saying, let me sign up for, 2 weeks of shots and creating embryos through IVF and then just, kind of choose a surrogate. It's a very emotional, journey. It takes, like you said in the first episode, it could be on average 18 to 24 months to even get to the point of trying to conceive. And it's many, many steps. And so I appreciate your experience with this process and helping all of our patients at Pacific NW Fertility and sharing your own journey. I just appreciate you so much.
It's my pleasure. It's my pleasure. I think most of us too, there's a lot of time and effort and consideration, and that not just falls on the emotional side, but on the financial side as well.
Absolutely.
And sometimes all of those things combined take time and patience, and also time to process
Yeah.
of what it looks like.
Absolutely. So when I reached out to listeners and I reached out to Instagram and TikTok communities, I asked, what do you want to ask Mollie? What questions do you have about surrogacy? And I'd love to read them to you
Please.
and
Please.
get your answers.
I'll do
So
my
the
best.
first one is why do people want to become a gestational carrier?
I think it really does fall to altruistic reasons. They really do want to be able to help another family grow and or complete their family. Often surrogates have completed their family and they feel like pregnancy, if you will, is their superpower, or pregnancy has come easy for them. And,
Yeah.
for those of us that need a gestational carrier, we're grateful that they lean into it, for that reason. While they may be compensated, the intent does come from a place of helping others be able to grow their families.
Absolutely. And I will ask gestational carriers, as I'm helping them, embryo transfer, or ultrasounds, or those kind of meetings that we have, I like to know, like, how did you hear about doing this? And, how did you think about doing this? And they almost always have their own personal journey of a family member that really struggled to conceive, or, they really did enjoy being pregnant and they would love to give this gift, to help others. Absolutely, you're right. There is compensation, but I just want to remind people that pregnancy is not health neutral. It can be very hard on the body. There can be unexpected things like multiple visits, bed rest, difficult delivery. And so, someone who's doing this, we really try to make sure that they're very well informed and on their side from the carrier. If it was just a transaction, just a financial transaction, I don't see that as the prime motivator.
I agree. I
Yeah.
absolutely agree.
What's the difference between a traditional surrogacy and a gestational surrogacy, Mollie?
Yeah, so the biggest difference between, and there's quite a few, but traditional surrogacy is there is a genetic relationship to the child that they're carrying. Often the surrogate is utilizing their own egg. Versus gestational surrogacy is there is no genetic relationship between the carrier and the embryo or fetus that she's carrying.
Yeah. And in my experience, I've been practicing for 20 years. I've never helped someone build a family where there was a genetic connection. I think that that's where a lot of the, horror stories about, people changing their mind and deciding, when the baby delivers that the carrier is going to keep the pregnancy. I think when there is a genetic link, if it's that person's egg, it becomes, a court case. And you hear about those, from 25, 30 years ago. And that is just, in my experience, I've honestly never seen it happen. Mollie, does it still happen? Do you have traditionals?
I don't work with any families here or even outside of PNWF
Yeah.
that are pursuing traditional surrogacy. I think that in all 50 states, it is not highly recommended, but it's also the legal landscape of it is much more complex.
Yeah.
And so here at PNWF, I don't have the opportunity to support patients with traditional surrogacy because of just the risk and the complexity of those journeys.
That's great. I had somebody ask on Instagram, how involved can intended parents be in the pregnancy, checkups and in the delivery room? How does that work?
I love this question. So often, I encourage intended parents from the very beginning to start to put together a list of things that they feel are really important to them. Personally, for me, a few things that were on that list was I wanted to be able to be at OB appointments. I wanted to go to the ultrasounds as a first-time parent. I wanted to be in the delivery room. I wanted my husband to be able to be in the delivery room. And I wanted to be able to I have a daughter. I wanted to be her first touch when she was born. And I got that opportunity. And I had the opportunity to cut her cord at delivery as well. But that all came really from the very beginning of finding a match that mutually met expectations of one another, both for the intended parents as well as for the gestational carrier. It's not one-sided. It's making sure that the match that you have meets that as well. And the agency's job is really to mirror and match that match the best that they can. And if it's a private match, usually you already know that you're a pretty good fit
Yeah.
if you're connected outside of an agency as well. But those things are really important to consider, or maybe you haven't considered them at the
Yeah.
beginning of this to put that list together of
Well,
those
I
things.
just like that you're recognizing the fact that it can be at different levels, because there could be intended parents that like don't want to be in the delivery room, and that's okay too.
Absolutely.
But finding that right fit and being really clear, kind of upfront, what you would prefer would be great. And also it could change through the pregnancy too, I can imagine. So but that communication piece, or kind of thinking about it beforehand, would be really, really helpful, and realizing that there's lots of different ways to do it.
Absolutely.
Yeah.
Absolutely.
I had someone from Instagram say, I need a carrier, but I don't know that I can do it because I might be so jealous.
Oh,
Can we talk about that?
for sure.
And I have had a couple of people who've used surrogacy, like Samantha Bush. She's married to a NASCAR,
Yep.
Kyle Bush, and they do a lot of wonderful community building, fundraising to help people build their families. And she had a child herself, and to add to their family, they decided to use a gestational carrier. But she was very conflicted, and she was really open about that, sort of feeling like this other person is going to feel the baby kick, and I don't know that that I can handle that. Do your intended parents ask you about that, or kind of talk about those really deep feelings?
Every day.
Oh my gosh.
That's every day. I think that and I think it's natural to be able, especially at the beginning, if you've transitioned from either whether you've carried your own child like she did, or you've navigated infertility, or you've navigated pregnancy loss, and now you're leaning into gestational surrogacy and every reason in between. It's not an uncommon, I think, feeling that comes up. I think that's why it's so important as part of this process too, that counseling is available and a resource.
Mm-hmm.
And there may be triggers that happen along the way, and you go, "Oh, I didn't know I had a feeling about this. I definitely have a feeling about this certain topic or our communication." And so knowing that you can lean into a village, whether it be your clinical team,
Mm-hmm.
a counselor, or even just your community that you're with every day, to be able to navigate kind of those complexities that come up throughout the
Absolutely.
journey, are important.
And I think it speaks to, and I encourage anyone who's listening now to go back and listen to that interview with Samantha Bush, because you do look at her on Instagram, and she's a beautiful woman, and she's, wearing beautiful clothes and things, and she's a celebrity. So you could absolutely assume, oh, well, this person, did it for that reason, like that number one misconception that it's because she wanted to keep her figure or something. And to hear her sort of talk about these conflicting feelings and emotions that she had, I think is really powerful. And just your sharing that it's actually really quite common. I hope whoever is listening and thinking about this and had those feelings realizes that they're not alone, that it's actually a pretty common feeling.
Absolutely. It is.
Yeah.
Really.
We're going to get back to asking Mollie more questions about surrogacy in just a second, but I want to remind you how important it is to support the show. Wherever you're listening, follow the show. It could be on Apple Podcasts, YouTube, Spotify, wherever you're listening. Following the show makes sure that you do not miss our weekly episodes all about reproductive health, and it helps others find this show who are curious about their own journeys. And if you really want to support the show, rate and review wherever you're listening. A 5-star review with a little bit of information about what you find valuable about the show can help so much. Now, let's go back to learning from Mollie. Oh, this is a good one. A great question from Instagram is, what are the expectations for a relationship with the gestational carrier after birth?
That's a great one too. And again, I think this varies from family to family or person to person of what you had envisioned. And I think that often, starts kind of a little bit from the beginning. With that being said, those feelings and decisions can change throughout a journey. Often if you're partnered with an agency, you're connecting with someone that feels like a stranger at the beginning. And as that pregnancy goes on or that journey goes on, you build a relationship and you like who they are as a person, And so sometimes intended parents say, this journey will end or the partnership will end at delivery. Other times people say, wow, they've become a friend or a family member. And then there's also a blend of the in between. For
Mm-hmm.
me personally, I started at the beginning of our journey. I didn't know if I wanted a relationship with this person. In
Mm-hmm.
fact, at the beginning, I didn't want to even really talk to her at first because I was so traumatized from our own history of loss.
Mm-hmm.
Fast forward, we had even tucked in language in our agreement that said, I'm not, please don't contact us for X period of time. I will say that lasted a whole 3 days. And I was so excited to send baby photos and texts back and forth. And now she's a part of our daughter's birthday each year. We get
Oh my
together
gosh.
annually. And she really has become a member of our family, where at the beginning, it did not, it was, there was hesitancy and
Yeah.
nervousness, in stepping into that side of
Yeah.
the journey too.
Yeah. And it sounds like you were really protecting yourself too, compartmentalizing a little bit. Like, I don't
Absolutely.
want to connect with this person because you
Are they
probably were.
safe?
Yeah.
Yes.
And is, this person going to have a miscarriage too? Like, am I just going to be connected? And oh my gosh. Yeah. I really appreciate your sharing that. I interviewed Tara Lipinski too for
Yes.
this
Yes.
podcast,
So
the
lovely.
Olympic ice skater, and she was talking about surrogacy, and she is very open about how their carrier has become a part of the family. And, she speaks, about her like a friend and how she's staying involved. And I thought that was really beautiful, but I can also appreciate that might not be for everyone. And it's important to think about what's right for you, but also, like you said, to be flexible. Like it could change.
Yeah, and I do see sometimes, if if someone connects with a gestational carrier, sometimes that first match may or may not work out. And there might
Mhm.
be 2 or 3 or multiple matches before you find the one that really feels like they're the right fit for your family. And so we do see that too, where there's perhaps hesitancy, caution. I call it being cautiously optimistic as you step in.
Yes.
And then as that relationship grows, and sometimes on the surrogate side, they're also looking for not to become a family member or not to become your best friend. And so finding that mutual match is so important that it aligns. If an agency isn't matching you with somebody that mirrors what you're looking for and what they're looking for, there could be a little bit of a rift even from the stepping into the process
Yeah,
as well.
absolutely. Yeah, thank you.
Mm.
Um, this is an interesting question. Can I breastfeed if I don't carry the baby?
That short answer is yes.
Yeah. I mean,
Um,
and that's just mind-boggling. How do you talk to your intended parents about this?
I did this with our daughter. So I did induce lactation. And so I share those resources openly. Some people start and they say, what does that protocol look like? We're going to lean into your um, physician team, but I do share what that looks like. And not everybody gets a full supply. I
Mm-hmm.
think there's the debate too on my side. I'm like, fed baby is the best baby. Sometimes that's milk that's donated from a gestational carrier to you. And or utilizing supplemental resources
Mm-hmm.
that you can attach, that you can wear and still have time to be able to bond with baby.
Yeah.
And sometimes people get a full supply. While
Yep.
I wasn't that lucky to get that, I still was very grateful for the opportunity to have a small window of
Yeah.
time to be able to try that, to do
Yeah.
that.
I mean, people who adopt babies do
They
this.
do it.
People who were not pregnant do this. It's a combination of medication and nipple stimulation and, being near a baby. And it takes a lot of work and patience. But thank you for sharing your personal journey with that, because I bet a lot of people had no idea that was even an option.
Even during a consultation as patients, I disclose that if a patient's like, well, this was my vision in carrying a pregnancy because this was also really important to me. Um, I will share that openly, if people are looking for that resource. And for those that come back and go, I didn't know, can you share? Yes, the answer is always yes. I'm happy to share those resources
Yeah,
with any of our patients.
I think that's great. Um, Do people have to have a medical indication for using a gestational carrier?
Short answer is no.
Yeah.
And so with us, it could be for medical reasons. It could
Mhm.
be for personal reasons. It could be for professional reasons that they may be leaning into gestational surrogacy. And I think that I see um, each person has their own unique path to becoming a parent, and it's respecting what that might look like,
Mhm.
as part of that too. And so helping them wherever they might be at, on that path of why they've leaned into surrogacy.
Yeah.
Kind of the caveat to that, though, is also when they start to look at agencies, some agencies nationally do have requirements for medical surrogacy or that don't do so what we call social or professional surrogacy. So I try to be mindful of that as well in providing recommendations to agencies, because then it's again another pain point when you have to share when you have the opportunity to share your story, then to be met with potentially a closed door feels frustrating and unfair.
Yeah.
So if we can avoid some of that, we try our best to do that too.
Yeah. And where does that come from? Like, why would an agency say that the person who is the intended parent has to have a medical reason? And what we mean by medical reason is like you don't have a uterus, or you have a cardiac issue or a kidney issue that like a doctor has said, wow, it is really dangerous for you to be pregnant. And I have actually seen mental health reasons as well be included. So I think it's really important that it can really be a full gamut. But where does that rationale come from? Why can't just anybody do it?
Yeah. So I think from agency to agency, that reasoning varies because there is not a governing body, if you
Mm-hmm.
will, over all of these agencies that say you have to follow X, Y, and Z rule.
Mm-hmm.
So from agency to agency, you might see that their requirements or the reasons or who they support can vary or fluctuate as
Mm-hmm.
well, which is often why I say, meet 2 or 3 agencies. If you meet one, you feel like they're great, fantastic. Try to convince yourself maybe another way with the next 2 meetings because you may still really like that agency.
Yeah.
But I do see that it varies because agencies now, they can set their own rules or guidance or, their business model,
Yeah.
how they would like to from state to state. Now, internationally, that varies too from, what we see up north or versus the United States.
But don't regulations vary from state to state as
They
well? Like
do.
some states require a medical indication for
They do
intended parents.
significantly. From
Mm-hmm.
state to state, it can vary, and that's where I think the guidance of one, your clinic and making sure that your clinic is an expert, but also having a really great attorney
Mm-hmm.
to an agency to be able to help you guide through that process and making
Right.
sure that it's a safe state to be
Mm-hmm.
able to proceed.
Yeah, like I know in my own practice here in Washington State, we had laws change in 2019 where we used to not be able to compensate carriers. And so my patients would go to Oregon or California or nearby states in order to find carriers. And so there's still people, I mean, that was 6 years ago, right? And there's still
Yeah.
people that say, oh, I can't do gestational surrogacy in the state of Washington because I heard that, years ago. But am I right about that law?
Yeah, and in Washington state, it actually is incredibly favorable for gestational surrogacy for even if the gestational carrier isn't residing in Washington
Yeah.
state to a donor as part of
Hmm.
that process. It's if anything, I've seen that it's even more in favor or robust toward surrogacy journeys, which is why I think so many people travel here globally
Hmm.
to the Pacific Northwest for care
Yeah. I
now.
also think that people are just in our political climate right now are looking for states that are in favor of reproductive autonomy on all different types of levels, like before pregnancy, in pregnancy, just the allowing reproductive autonomy is really important. And thank goodness the state of Washington is a very friendly state for having people make their own medical decisions. We don't have to get into politics right now, but I don't know if you can tell that I feel very strongly about that.
Well, and I think we do see it too on the surrogacy side with intended parents in helping them understand the landscape of what that looks like
Mm-hmm.
politically,
Mm-hmm.
of where their surrogate might be located,
Mm-hmm.
or if they have a preference. I think we see all sides of that, and making sure that they have a safe journey for all parties that are involved, and access to care is really, really important.
Yeah. Well, I just appreciate your going through all these questions that we got from Instagram and social media. Are there any other common questions or things that you'd like to share with listeners who are just learning about this process?
I think one other common question that I do receive quite often is, will baby be able to hear my voice?
Oh.
And familiarity. And so sometimes there are resources that surrogates will wear where you can record audiobooks and
Oh.
you can record your voice and your favorite music, and that your surrogate or gestational carrier can wear throughout the
Mm-hmm.
pregnancy. And so those are some things that I know you could speak to that more. But it was
Oh.
something even for my own personal journey that I felt like our surrogate did such an amazing job of helping us to feel included as
Mm-hmm.
first-time parents in this journey.
Mm-hmm.
And so having those resources available was something that is a common question of, I wanted them to hear my voice, or I wanted them to hear that type of a resource.
Yeah.
I would say another question that comes up pretty often is resources and disclosure of a child's birth story,
Mm-hmm.
and where they could find resources. And that for children usually leads to children's books. And
Yeah.
so often I'm providing a list of what those children's books are and resources that get shared with us in the clinic, and then to be able to support the community as well.
Yeah, because it's a wonderful way to, at an early age, showing pictures and kind of just children's books open up conversations. So there are books out there that talk about, you know, family building in a lot of different ways. And you wrote one, didn't you?
I did. I did.
Yeah, tell
I
us
wrote
about
a
it.
book called I Became Your Mama.
Mm-hmm.
And really I wrote it to celebrate my daughter's first birthday. But I would find myself taking, okay, 2 pages out of one book, another page out of another book, and going, this isn't quite her story.
Mm-hmm.
And so it started as a song and turned into a children's book for her.
Oh.
And it's been what I thought was just to celebrate her incredible birth story has turned into a resource for other amazing families, which feels like
Oh,
such a privilege.
that's wonderful. How do we find it?
It's on Amazon,
Mm-hmm.
Walmart, Target,
Just anywhere you can get books. That's
anywhere you can
fantastic.
get
And
books.
what's
Yeah,
it
you
called
can pick it
again?
up. I Became Your
I
Mama.
Became Your Mama. That's beautiful. Another thing that I have learned from my own patients and just kind of in the community is really creating a book about the surrogacy journey. So people often think about your birth story, like starts with maybe like, when you're born and like a picture and kind of like, and then like at month 1, 2, 3, you're doing these things, but taking it back to like, this is the first time that we contacted the agency, and this is the first time that we met the gestational carrier and what we liked about her at that point. And, just kind of creating that scrapbook and sharing the feeling of like, you were so wanted, like we wanted you so badly, like we worked on this process, and sharing that journey to kind of get there, because it really does take so much more than just like starting with a positive pregnancy test. And I think that, that some people have found beauty in that creative process, and then being able to share that with the child later. You share in that powerful journey. I don't know if you've shared that as a resource to people, but I've just found that to be a beautiful recommendation.
Yeah, absolutely. And even in our own home, we call it her me book.
Oh.
And so writing it out so that they can understand, in our family, it was an egg helper, a sperm helper, and a tummy helper. And so laying all of that out, and then sharing more about each of those people that
Hmm.
contributed to bringing her into the world. And the same for intended parents or patients. As you're coming through this, every one of our journeys looks so different and unique and beautiful just as they are. But having that resource for your child to be able to share is a really powerful tool. One, for helping them understand, but also for you to be able to tell the story of what their birth story looks like, and being able to practice that even early on
Yeah.
is really helpful as our kiddos grow
Oh,
up.
that's just great. Mollie, I have so enjoyed having you on and back on the show to answer these questions. Anything else you'd like to leave the listeners with who are learning about this process?
I think more than anything, know that you're not alone, and that there are people that want to help, that want to come alongside of you, where their intent is to uplift, protect, and guide you along this journey. And I'm always happy to be that resource. I know that our entire team and clinical team is happy to be that resource at PNWF. And I just want to say thank you for having me
Oh,
on
thanks,
today.
Mollie. I hope you found this episode valuable. I'm so happy that Mollie came back to answer more questions about using a gestational carrier because it is a beautiful way to build a family, but it can be overwhelming and full of lots of questions and lots of confusing topics. And Mollie is just a wealth of information from her own personal journey and all she does to help my patients and all the patients at Pacific Northwest Fertility that are thinking about surrogacy as a way to build their own family. You can find this episode and all others on my website, drlorashahine.com. Thank you to my team at Audiotocracy for producing another great show. And thank you for being here today. I am so appreciative that you show up and listen and learn every week. Be sure and follow the show wherever you're listening so you don't miss a weekly episode all about reproductive health. And until next week, let's stay brave and curious.